Good afternoon, distinguished members of the panel, ladies and gentlemen. I am Kithsiri Mahasen Mulleriyawa, working as a special grade nursing officer attached to the National Hospital. I have 20 years of experience in nursing. Today I am here to present my research on assessment of the perception of nurses on clinical supervision in nursing at National Hospital of Sri Lanka. My abstract number is 36 page, which is in page number 36. This is my content. Introduction. Clinical supervision is a major concept in nursing practice. It provides nurses an environment for better practice for betterment of their clients. Objectives. This is my objectives are this research are to identify the recent status of the clinical supervision in nursing at National Hospital of Sri Lanka, to identify the need of clinical supervision at National Hospital of Sri Lanka, to identify the barriers of clinical supervision in National Hospital of Sri Lanka. Methodology. For my research, I use descriptive, cross-sectional, quantitative design. My study population is nursing officers of National Hospital of Sri Lanka who is working from January to May 2015. Sample size is 120 nursing officers. Sample method is convenient sampling. Special grade nursing officers, ward sisters and ward masters students were excluded from my research from the sample. Data collection method. Self-administrated questioning. I use self-administrated questioning. This is my result. When we consider the gender, majority of the participants are female. It's compatible with the male-female percentage of nursing profession. According to this study, nurses select special grade nursing officers as their best supervisors. Personal idea regarding supervisor: 66% of nurses expected supervisory guidance was needed. Supervisors motivation too. This study revealed 78% supervisors were motivating their nurses to perform better nursing practice. Supervisors feedback on how the practitioners were going on. 67 nurses got feedback about their practice from their supervisors, and 33% didn't. Supervisors supposed to understand difficulties in practice. 67 said supervisors be with them in their difficulties in their practice clinically. Supervisors problem solving approach. This shows the problem solving approach. 67 of nurses said 67 of nurses in positive idea regarding that. Supervisors time spending with the staff. According to this study, 70% of supervisors time spending with their staff. Supervisors approachability. According to my findings, 75% of nurses could approach their supervisor easily. Supervisors' knowledge on his satisfactory. Also, 74 nurses said that their supervisors knew about their abilities and talented. They are concerning their nurses' abilities and talented when they signing or supervising the nurses. Supervisors duty delegation method. 73% of supervisors delegate duty respectively. Supervisors follow up on duties. 77 nurses got follow up from their supervisors and they thought supervision is needed. Discussion. According to the findings, majority is believed that the best supervision is come from the special grade nursing officers in nursing setup. Majority perceives that the clinical supervision is wanted for a better practice. The minority who are not in a positive perception about nursing supervision have not enough experience. recommendation. My recommendation is the minority who are not in a good impression in clinical supervision is better to be re-evaluated in detail. I think it is needed re-evaluated. Further research should be carried out to assess the gaps in knowledge and skills on clinical supervision among supervisors. These are my references. I express my sincere gratitude to all the participants, to staff of International Institute of Health Sciences, especially Dr. Nishan Silva, my supervisor Mrs. P.L. Jayawardhan, Head of Nursing Department.